No. It is, honestly, it's just two people, like you've got your chair and your table over there. It's just two people sat in a room together having a very... It's not even massively structured. It's just a really nice, safe, confidential.
Yeah.
Got to be confidential. That's the only way it works.
Yeah.
Environment for two people just to chat, for someone to feel like they can speak to someone, not be judged. It's a really big part of counselling, not to be judged. For that someone to sort of like feel like they're walking in their shoes and understand where they're coming from. So empathy.
Welcome to the Tackle Your Thoughts podcast, the podcast where we attempt to tackle the stigma surrounding mental health. So, without any more delay, here's the boys.
Okay, welcome to the Tackle Your Thoughts podcast. Today, we go a bit deeper. Today, we welcome one of our local counsellors to us, Louise. So, Louise, you're going to be sat here. We're going to quiz you quite a lot about what you do. But it's a kind of different kind of podcast for us today. Where we normally get a guest on who is suffering with mental health. Today, you come from the other side and say what we can do to combat it. So, welcome, Louise. Thanks for joining us.
Thanks for having me.
So, what we always do, we always go right back to the start and literally just ask you to tell us about yourself. Okay. How did you get into being a counsellor, and how does real life look?
Okay, fabulous. Hi guys, thanks for having me today. So I never really thought years ago about having a career in counselling. It was never really something I ever wanted to do. I had a bad experience as counselling when I was younger.
Right.
So, and then since then, sort of like, there's been occasions where people turn around and say, have you considered counselling? Things happen. Yeah. Life happens.
Yeah.
No. I'd never go back into counselling because I had such a bad experience when I was younger.
Right.
And then one year at work we had, when you have sort of like fake awards at work and it's like the best dressed at work and everything like that. And everyone used to always say to me, oh, Lou, you're such a great listener. Have you ever considered going into counselling? No, never really thought about it. And then one year at work, I got agony aunt in the Christmas awards at work. I was like, okay, maybe this is telling me something now. So I just had my son. I'd just gone back to work, and I thought, right, now I really need to think about what I want to do. I was like, do you know what? Yeah, I'm going to go into counselling.
Amazing.
So I signed up for level 2 counselling, which is the first stage of counselling. We start up at level 2, and then you work through level 3, level 4, which I don't mind coming on to later. But what really surprised me about counselling is a lot of people think that going to counselling means you're going to go there and someone's going to tell you what to do, or someone's going to give you advice, and that's not what it's about at all.
It's kind of the opposite.
Yeah, absolutely. It's opposite, because it's just so much more empowering, just allowing someone to feel like they're being listened to and just holding that safe place for someone.
Right.
That they don't need to be told what to do, and it's much more empowering if they can try and figure out for themselves what it is they need to do and where it is they need to go.
Right.
So I went through all my years of training. So it took me 4 years to qualify. So you do sort of like 1 year at level 2, and then you go up to level 3, which is another year, and then you do 2 years at like level 4.
Yeah.
So I am a qualified counsellor, level 5 diploma in therapeutic counselling. I know, right?
That's awesome.
And then since then, really, sort of like since I qualified, things just got really busy. Obviously we know how big mental health is out there now. So much more bigger than what it used to be, really. So I'm a counsellor. I've worked in workplace counselling. I've done a lot of workplace counselling, local authorities, occupational health. And then I kind of fell into teaching counselling. So I also teach counselling now. So I teach level 3 and level 4 counselling at a local college. And I also support students in mental health. So I'm a mentor for university students that suffer from mental health. They get funding to have support throughout their course. So that's something else that I do as well.
Wow.
So lots of mental health. So
very busy.
I'm now in private practice, so I actually have my own private practice now, which
So where does the family fit in?
Well, luckily I work from home a lot, and there's a good thing about having your own practice and working sort of like self-employed. I can work my practice around my hours and family. So I make sure I have my weekends, especially. Try and have Fridays off as well. So it's just about managing that work-life balance. I'm busy Monday to Thursday, and then I try and give myself Friday to Sundays.
No, I like that. I sort of leaned into that. That's the reason I left work. I told the boys before, but the work-life balance is so big, and it can, work is 5 days out of 7, you know, you have 20 days off plus your weekend. You spend a big chunk of your life working. So yeah, it makes sense to get that.
We spend more time at work than we do tend to spend with our families and our loved ones, don't we? You know, so it's really important to get that right balance.
Yeah. So you're saying growing up, you never wanted to be a counsellor? No,
because just based on a really bad experience I had in childhood, I just didn't want to
talk about
never ever thought about going back to counselling. It was like 20 years later when I thought, okay, well maybe let's just go and see what this is about then. And it's not about what my experience was as a child.
Was your experience you getting counselling? You went for counselling? Okay, makes sense.
Yeah, absolutely.
Okay.
How do you feel now then? So obviously you've been to counselling and now you're the counsellor.
Yeah.
Is it nice to kind of give back? To think, I remember being there. I remember being the opposite side of the table or chair or whatever it is.
It's just valuable. I can't think of the word that I need to describe right now because I've had a lot of brain fog since I COVID. But there's just something really valuable about being able to give someone a really safe place to feel like they're listened to, because life is so busy. You know, you walk into a room and you want to speak to someone, and then they pick up their phone, you know, and someone else walks in and you want to talk, or they talk, oh, I know how that feels, and they start talking over you. But counselling's not about that. It's like about having 50 to 60 minutes where someone really does listen to you and they're really interested in what you've got to say, and they're really seeing things from your point, and they're not trying to give you advice, they're not trying to tell you what to do, they're just really hearing you. And that's just the power of counselling, really, just feeling heard, you know? And it's
amazing.
just so valuable going on that journey with a client when you see where they are when they first come to you in that first session, and maybe 6 to 8, maybe 10 sessions later, you see that change, and you know, and they're like, they're just so grateful for being given that space to be able to get to where they are. You know, a lot of them will come to counsel at the beginning and go, I can't even see a way forward, and then at the end of it they're like, I couldn't even imagine myself here 6 to 8 weeks ago.
Amazing.
Do you get people who come to you thinking, oh, this is not going to work, don't even know why I'm here, just going to tick the box, I come and see Louise and I'm going to be the same person when I leave?
Absolutely. I actually, only a couple of weeks ago I've just finished, he's got one more session, I've just working with a guy. And he said to me, when his GP first mentioned to him about going to counselling, he was like, what on earth can counselling give me? How on earth can be speaking to a stranger just tell me, you know, help me feel better than what I am now? And then here we are sort of like 8 sessions later, and he's like, you've changed my world. Even I have no idea that I could feel this way. And to the point of he's even considering going into the counselling profession himself. He said, because it's just... He said it's just so empowering.
That must be so satisfying for you, for anybody who gets involved. But
that's why I do it.
I suppose, like selfish, but it's not. It's kind of like altruistic as well. But there's a guy that I follow on Instagram called Ed Cunningham, and he sort of pushes people to go for counselling if they have no issues. So if you've got no issues or no problems and you have no struggles, just go and have counselling, because it might make your life better. Like it's like a positive...
Better again.
Just
levelling up all the time.
That's the thing. Like, that's the thing. The Americans do that, don't they? They all have regular therapy in America. But over here, we tend to use counselling as a crisis, as a reaction to a mental health crisis. But I always encourage people that even once counselling's over, if they need to come back, they notice things are not going quite right, or they just want to have a chat about something. So I've got some clients that just like to have a regular check-in on a monthly basis or on a bi-monthly basis, just as they know that it benefits just to speak to someone.
Definitely.
You know, so it's good to have regular therapy. So it's better to be proactive.
100%.
Rather than reactive.
We spoke about it before. It's like you said, it defaults to, I've got a problem now, I need counselling. But we talked about
firefighting.
Like mental wealth rather than struggles with mental health, and building that, you know, that resilience and whatever else in your mind. You could do that without actually needing counselling. You know, just go and have it anyway.
You don't have to be in any kind of sort of like mental distress as such to have counselling. You can attend counselling at any time.
Amazing.
Literally just to listen.
Yeah.
We've spoken about this quite a lot, but at the beginning of this, really, about what a usual counselling session looks like. So I'm thinking a lot of people wouldn't go to counselling because they don't know what to expect. And they're probably scared.
Anxious.
Thinking, they're already suffering with anxiety. Then they're going to be a little bit more anxious going to a counselling session. So, can you explain what a counselling session is? Is it what you see on films where you've got a guy laying on a sofa?
There's a huge leather chair that you've got to sit on.
There's a guy in his shirt and tie with a book and just analysing you, or is it not?
No. It is, honestly, it's just two people, like you've got your chair and your table over there. It's just two people sat in a room together having a very... It's not even massively structured. It's just a really nice, safe, confidential... Got to be confidential. That's the only way it works. Environment for two people just to chat, for someone to feel like they can speak to someone, not be judged. It's a really big part of counselling, not to be judged. For that someone to sort of like feel like they're walking in their shoes and understand where they're coming from. So empathy. We always start off counselling with a therapy agreement anyway, because that therapy agreement helps to outline expectations. So we talk about confidentiality in areas where confidentiality can be broken, because we do have a limit. We have a responsibility to people's well-being. So if we're worried about their own safety, then we would have to break confidentiality. That all gets discussed in the first session. So it's just outlining expectations and boundaries. The counsellor might talk about what sort of approach they use, because there are 3 different main approaches to counselling. That's humanistic. Humanistic counselling, which is very much about those core conditions I just spoke to you about, really. So the empathy, unconditional positive regard. And my mind's gone completely blank. This is COVID coming together. These 3 conditions: non-judgmental, congruent. Sort of the counsellor being genuine. There it is. And just sort of like helping the client, again, sort of not giving the client sort of like advice, but just seeing it from their perspective and helping the client see where it is they want to go with things. So it focuses very much on the now and the future. Doesn't really focus too much on the past. It's all about helping that client towards what we call that fully functioning individual, getting to where they want to be in life. So that's more humanistic. CBT, you guys probably heard of CBT. It's cognitive behavioural therapy. That's very structured. Very much looks at sort of like challenging irrational thinking, negative thoughts, putting in place sort of like mindfulness, distraction techniques, that sort of coping mechanisms, which I'm sure we'll speak about later. And then there's also a lot more of a longer term approach, is the psychodynamic approach, which very much looks back at an individual's childhood and how events, personality and things like that have developed from back along in their childhood, and how that impacts their behaviours. So that's very long term, as you can imagine, because that goes all the way back. That's really intense. And that can take, some people can be in psychodynamic therapy for years.
Can they really?
It's really good for things like childhood trauma and stuff. So so the counsellor then, going back to the session, would talk about what sort of approach they use. It's a getting to know you session, that first session as well. So I always say to my clients as well, this is about you getting to know me, because if you feel like I'm not the right fit for you, or I'm not the right counsellor for you, that's absolutely fine. Then it's so important you go off and find someone else that does for you.
Yeah, of course.
And there's sort of like, we ask what that person hopes to gain from therapy, so it gives us an idea of what we're going to help them focus on through the therapy sessions. We do regular reviews in therapy every sort of like 4th or 5th session, just to make sure they're getting what they need from therapy. And then throughout the sessions, then we kind of reflect on sort of like what we've talked about previously in previous sessions. Because there's a lot of, with therapy, we talk a lot in those like 50 to 60 minutes, but that's 50 to 60 minutes in someone's life over the space. If you have that weekly or fortnightly, there's a lot of work and processing and reflecting that goes on outside of the therapy room.
I can imagine.
So we talk about that when they come back to other sessions. We talk about, this is what we talked about last time.
Do a bit of a review then, is it?
How things been since we last saw you. Have you had a chance to reflect or process, or do you know what, I've had this light bulb moment since that I've been reflecting on what we discussed. So it's a lot of reflecting and processing going on in the therapy room and outside of the therapy room.
I bet. What happens then if I come in and go, there's nothing wrong with me, I don't even know why I'm here?
Okay. Why have you come to therapy? Someone told you to come to therapy?
Yes, that's what normally happens. The GP normally says, try these tablets or something and try therapy.
Okay, why are you on tablets in the first place? Why did you go to GP for medication in the first place? There's something there, isn't there? You've gone to your GP for a reason. The GP's given you medication. They've gone, okay. We do get a bit of resistance in therapy. Ideally, we want someone to be in therapy because they want to be there.
Not forced.
Not forced, especially said, I'm coming to therapy because my mum told me to, or my partner told me to. Most of the time, people are there because they want to be there.
It
doesn't often happen where you get a bit of resistance. but I did have it recently. Someone because you have to have therapy. Some courses require you to have therapy as part of training to be a counsellor.
Right, okay.
So yeah, absolutely. So the particular one I teach doesn't, but I know the ones in the area that do need you to have therapy to train.
Yeah, makes sense.
And yeah, I had a new client about a month or so ago, and she was a student, and she was like, I'm here. I don't know why. I don't want to be here. I'm quite angry that I've been made to come to therapy.
I don't even need it.
I don't even need therapy. So, but we just had a general chat really about her life and things have happened. And at the end of it, she was like, oh, okay. Well, maybe I have got some things to talk about in therapy then. So we certainly wouldn't force the issue, but we'd certainly say, okay, well, let's just have a general chat about life and where you're at and how you got to your GP, what led you to go to your GP in the first place, and let's see what got you here in the first place.
I guess if you dig deep enough, anybody's life is going to have some sort of issue, problem, query, whatever it is. That you go far enough back, as
you'll find something.
Relationships.
Yeah, exactly.
Childhood.
Grandparents and things like that.
Yeah, some of it's the culture as well. You get some people, we see a lot, there's a lot that was in there years ago. Mental health wasn't really recognised. There was the whole stiff upper lip, and we're still seeing today sort of like the impact that has had on some people where they've not been able to talk as they were growing up because, the generation before said stiff upper lip, don't talk about your emotions. And because their generation before that was the same as well, we're still seeing the impact really that can have on someone's well-being even now later on in life.
We speak about that quite a lot here because we're all ex-rugby boys. People think it's weak to speak about your mental health or your issues you have at the moment, so we're trying to break that stigma in local rugby clubs and everything. But it's so hard because
it's difficult.
If I talk about my father, he would never speak about how he felt. Just get on with it. Come on, like we keep saying, man up. That's probably the worst saying. We hate it.
Awful.
But it's just a cultural thing, generational.
It's
generational, I think.
But we still at the back end of that, really, aren't we? Especially in rugby clubs.
I think stuff like this, podcasts, the internet, everything has helped the world soften to that a little bit and realise that, we've still got a long, long way to go in terms of getting people to just open up and talk. But I think in the past, people have only known a smaller circle of people, group of people, and just not had the opportunity to speak out or be heard. So they've.
Have you seen a change in the world? To say a lot more people are talking about it now compared to they used to be, or not?
Yeah, and men.
Men, especially. I can imagine.
Men. I'm getting more men coming through now, going, okay, I really need to talk about my behaviours and how I'm feeling, and because I'm hoping that will help change how I behave in the future, and sort of like some of it is about sort of I'm just thinking about some clients I've worked with lately that are men sort of like I would never have done this before, but I know that I really need to do this now because things are not going to change for me unless I take that step. But definitely a lot more men now, and older men.
Is it really? That's the part like we spoke about earlier when that stat about suicide saying what was it between 20 and early 20s and late 60s, and that's the part I struggle with. Like people in the late 60s who commit suicide.
I know,
but like we said earlier,
it's scary.
It's a scary, isn't it?
Yeah. But that's the time in their life where they're experiencing change and what's the meaning of life. Especially if they're losing loved ones as well. They've spent 40 years. There's a big sense, there's a change to their identity, who they are as a person. There's a lot of loss going on later. People around them could be passing away when you start getting to 60s and 70s. They start questioning why they are there and what they're going to do with the rest of their life and things like that.
Yeah, of course,
have you done any kind of counselling on the older generation? Yeah? Because I'm guessing they're probably at the height of, I don't need to speak, I'm okay, just man up and get on with it.
Yeah, not many. But I can think of a few. I remember a lady that I was working with when I did my training years ago, actually. And she was really, really open. In fact, she's probably the oldest person I've worked with. She was in her 70s. So there was lots to talk about because it's almost 70 years worth of life to talk about when she came to therapy. But she absolutely loved it.
I bet she did,
Yeah, she had about 12 sessions and... she said what she gained from those 12 sessions just to really talk about and explore how she'd got to where she was, how she was going to manage going forward because she was living on her own at that point and she'd had and she'd split up from her, her long-term partner, and again, a change of, a sense of change of identity and who she was and what her life was going to be going forward. So Still not many.
Yeah, of course, yeah.
Still like to see more, because like you said, we said, it's about having that stiff upper lip, but definitely getting some of the older generation.
That's good.
Amazing.
It's nice to see you are literally breaking that habit, really.
Yeah.
And just being that person there. For me, I'm going to ask a question about you personally. If you're sat down with, say, 6 people a day, does it get tiring? Does it take it out of you? Do you struggle at all?
I don't see 6 people a day.
No.
It wouldn't be safe or ethical.
No.
Yeah.
For me, I just couldn't. I just don't feel like if I see 6 people a day, I don't feel those 6 people are getting the best of me as a counsellor.
Awesome. Yeah.
I would do 4, maximum 5 a day, and you need to make sure you've got a appropriate time in between sessions as well to sort of, because I have to use sort of like mindfulness. So I have to ground myself.
Of course you do.
I have to go
Got to look after yourself.
write my
you can help
notes, and
anybody
then
else.
go and have a cup of tea, go and stand out in the garden, because there are some sessions that will really take it out of you. That will. I'm only human.
Of course you are. Of course,
I can still feel quite tearful at things that people bring in. So sometimes I remember at the end of one client session once, I actually went and stood out in the rain. And there's, we'd had such an in-depth session, and it was just so intense.
Yeah.
I just walked out. It was at the beginning of the pandemic, actually, when we started working from home. And I just remember walking down the stairs, going out into the garden. It was pouring down with rain, and I just stood there in the garden, and I almost felt like the rain was like washing it away, But it's so important to take that time out in between counselling sessions to sort of ground yourself, give yourself time and space, and then time to then get back into the room and be present, ready for your next client.
Because people are literally offloading their problems onto you.
Yeah, exactly.
So do you carry their problems around, or you need to
No, it gets easier. It does get easier. It's harder when you're training.
Right, I can imagine.
I see it a lot with my level 4s that are on placement at the moment. It's really difficult. But it does come with experience. It does come with time. For us, really, that's the importance of clinical supervision in counselling, because that gives you a safe place to go to talk about sort of your client work and what you make sure you're looking after yourself.
Right, okay.
Identify any areas for training and things like that. But counsellors can have counselling too.
That was my next question. Surely you'd recommend a counsellor go for counselling?
Yeah, a counsellor can have counselling too, and I've had counselling since I've been a counsellor.
Wow.
So you have
did you feel better afterwards as well?
Yeah, 100%. It would just feel a bit, I'm encouraging people to have counselling, then I wouldn't see the benefits of counselling myself.
We talk about anybody can have mental health, but just because, or mental health issues, just because you're a counsellor doesn't mean you're not open to that.
Yeah, made of steel and can take
it's the same as saying to a doctor, you can't have a broken leg.
No, exactly.
Because you fix broken legs, sort of thing.
I suffer from anxiety. I'm quite happy to say that. I'm a counsellor, but I suffer from anxiety. And one of the things as well that you say about they say about doctors and nurses making the worst patients, don't they? Sometimes you feel, well, maybe a counsellor makes a worse client as well. And I remember going to the doctors about 2 or 3 years back when I was particularly struggling with anxiety, and she looked at me, she went, "What do you do for a job?" And I said, "I'm a counsellor." She went, "Well, then surely you know what you need to do to help yourself."
It's not
it's not the same, is it? It's the same as why we wouldn't sort of counsel our own family and friends. It's not the same, So you
can't do certain exercising yourself, So Louise, I'm going to have a chat with myself for you now.
And the point of counselling is that you get to open up to somebody and they can listen to you and validate what you're thinking.
100%.
If you don't have
100%.
that, if you can't voice it to yourself, you can't record yourself and then watch it back.
Have a little internal conversation with myself.
It's just your brain's going to go around in circles.
Interesting. No, that's brilliant.
That's amazing.
You talk about anxiety then. Let's talk about the most common conditions will come to you, because I'm guessing there's a broad spectrum from, like we said, the Americans who have got no issues and they feel on top of the world and they just want to level up, to probably some who thinks that they've hit rock bottom. What's the most common conditions will come to you?
Really, at the moment, and it's real no surprise with what's going on in the world, or what has been going on in the world over the last 2 years, is anxiety.
Imagine.
But it's about finding what sort of the crux of that anxiety is, or what the triggers of that anxiety. And it has been the pandemic, it has been working from home, but a lot of workplace stress.
Is it really?
I get a lot of workplace stress. I've done a lot of workplace counselling anyway, but even since going out into private practice, I've had a lot of people coming to me with workplace stress.
That's huge for me, the worst. Sorry, just to go back on that, because people, like we said earlier, you spend so much of your time in work. If you don't enjoy it, it's something I always shout about. But if you don't enjoy what you do, you've got to change it up. You can't just stick at something that
just there for the money.
It drives you mad or whatever. You need to escape that, whatever that escape is, whether it's something after work or on your weekend or change it up. But super interesting.
But that's the issue that the pandemic's brought. The pandemic has brought, we've gone, before the pandemic started, it was exciting to be able to work from home. I'm going to work from home today, I'm not going to go into the office. And
I'm going to get changed today.
Yeah, exactly. But it's gone from working from home to living at work.
Yeah.
And people are struggling with that. And a lot of things I've found is like not being able to, even the importance, something's come up quite a bit actually, is the importance of what that commute does for us when we're on our way to work in the mornings, getting ready for work, half-hour drive to work, and that commute back from work, getting the work, thinking about what's been said and listening to a bit of music on the way home and just prepping yourself. But now you get up from your desk,
it's just blurred.
And then you're at home already. You don't have that time. So some of the stuff that I've been doing a lot of since the pandemic is just to encourage people to do like fake commutes to work. They're getting up in the morning, get up half hour earlier, go for a walk around the block, pretend you're working. You're walking to work, and then the same after work. That has been really essential. So that's a lot of workplace stress.
Super
people sort of like not having those boundaries in place when you're working from home. The laptop's there. I just quickly check my emails.
Just checking the emails.
9 o'clock at night.
I'm so guilty of that. Like I'm always checking emails. Like first thing that I do in the morning, open my phone and I'm checking emails and I'm like, I recognise them. Like I shouldn't do this. Like I didn't need to do this. But
I love what you just said about the commute home from work. Because I'm guessing a lot of people use that time just to switch off. Just to kind of like walk down the steps from work and thinking, I've left work now. Let's get over it and let's get back into family life. Where if you're at home in the kitchen at your desk, you get up and walk into the living room and you've got like a 5-second commute.
Yeah, absolutely.
Makes so much sense, doesn't it? But it's
so
something you need to think about.
Yeah, you wouldn't think about it. I wouldn't consider it, but
No, and not everyone's got the benefit of having like, I consider myself quite, I have to really with my job, but I have an office.
Yeah.
So at the end of the day, I can turn my laptop off and I actually keep my office door shut. I walk out of my office just even that action of shutting my office door says to me, right, that's it, work's done for the day. But some people don't do that. They have to work in their living room or work in their dining room and stuff like that. And they can't, so then we have to think, well, maybe you need to make sure you're turning your laptop off and actually putting your laptop in a drawer somewhere. That's your act of finishing for the day.
Like a trigger that says that's your end point.
You've clocked out.
You can't clock out. It's like the old school, like stamp yourself out and you're done.
But that's all about boundaries, managing boundaries. That's where workplace stress comes in a lot, especially with the pandemic. People not being able to have those boundaries in place. Some people struggling, couples working at home together. Had a lot of that as well. I can hear him on his meetings and I can't concentrate, or I've got a day off and he's working, so I can't relax around the house, that sort of thing, But a lot of workplace stress. Some relationships have some childhood traumas. I get some childhood traumas coming through, but the majority of it is really, if you're looking at what we're getting a lot of, definitely anxiety.
Is it really?
Yeah.
Going back to the childhood thing, I'm just my personal interest, I don't know, but do you find that people are unaware of childhood issues and trauma and unaware that might be the point, the thing that's causing them, stress, anxiety, pain, whatever it is?
100%.
Is that a thing?
Because there's something, I don't know if you guys ever heard of it, there's something that's called schemas, and they're things that are developed. It's how our brain sort of like puts together sort of like, it's almost sort of like, what a nurse looks like. If you think about a nurse, it's how your brain sort of like can say, right, that's a chair and I know I can sit on that, or that's a nurse, I know that person can help me. Sort of almost sort of like, it's like a little filing cabinet or a little, sort of like how we compartmentalize and manage things in sort of like our brains. But these schemas they start from childhood and they can lay dormant, especially with childhood trauma, they can lay dormant and then get triggered later on in life. So you could have someone that was bullied through school, they'd be absolutely fine, carry on through life, get a good job, and then one day their boss changes, their new boss bullies them, triggers that from childhood, and they don't realise that's where it's come from.
They just think it's that the work.
Wow. But it can come from as far back as childhood.
It's so interesting.
How would you know that then? You just got to drill down further and further as a counsellor, do you?
Well, it's just all part of the process, reflecting, hearing their narrative, hearing their story, and sometimes they choose to go back and sort of like go, well, do you know what? I remember now. actually this happened when I was younger, and then they put 2 and 2 together, you know. So it's just all part of the process of just being heard, hearing their story, giving them that safe place to talk, and then they go, do you know what, that makes sense now.
Yeah.
I remember when that happened, and that reminded me when that happened with my boss. That was a familiar feeling I had from back when I was being bullied by this person at school, something like that.
Yeah, it's wild, isn't it? So interesting.
Unbelievable, isn't it? So you touched on, you're saying the most common condition is anxiety. For me, a lot of people just go, I'm a little bit anxious today. I'm a bit nervous. How do they then make a decision and go, I should go and speak to somebody?
Honestly, when it starts impacting you on a day-to-day basis, really.
Right.
If it's, I mean, like we said you can come to counselling at any time. You know, you could, whenever you feel ready to speak to someone. But with anxiety, it's when it starts to impact you on a day-to-day basis. So people are like worried about when it starts affecting their behaviours, and they're like, I'm going to start avoiding social situations because they're making me anxious, or I can't get up and I can't look after myself, and I've got no self-care. You know, and all I can think about is these irrational thoughts, and it's making me really sad. And so when it starts affecting their behaviours, anytime, like I said, you come to counselling at any time. But if you think you really want to start thinking about when you have help, it's got to be when it starts impacting your life on a daily basis, struggling to get up in the morning, struggling to go to work, having these irrational thought processes, that sort of thing.
Because I'm guessing everybody gets anxious.
It's natural.
It's natural. Is that just the body's way of dealing with something?
Absolutely.
But like you said, once it starts becoming a problem, impacts on a daily life, then that's when you need to start.
And the people come to counsel because they think, I've got anxiety, and then a few people actually said this to me. Will you take my anxiety away? Will the anxiety go away? No. It doesn't work like that. Anxiety is a perfectly natural human response. It's part of us as humans. We, it's what powers us through sometimes. We can power through anxiety, but it's just when it gets in the way. And counselling won't take that anxiety away from you, but it will help you to understand your anxiety, potentially where it might be triggered or coming from. And also how to manage it, coping strategies and things like that.
I guess like all the I don't know what they call, I guess, emotions or whatever it is, like anxiety and whatever else, everybody's got an element of those in them. And like you said, it's human nature, and we've developed over hundreds of thousands of years to have those things for reasons. So it's really important that we don't just,
everybody gets good days.
I got anxiety, I need to get rid of it and not be anxious about anything. It's just managing it, coping with it, being self-aware about it.
Because people think anxiety is bad as well. Because of how it makes you feel. But it doesn't have to be bad, because it's a perfectly natural human response. So I think you can validate people's feelings as well and say, look, it's okay to feel anxious about this. A lot of people go, is it okay to feel anxious? Is that a thing? Am I allowed to feel like, well, you can. It gives you something to explore. It gives you a chance to really think about it. Think about if there's anything that needs to be changed, and then we can help you sort of like manage it and put things in place. But validation of feelings, what you said, is really, really important in counselling.
Like negative connotations, like associated with it. So people think anxiety and depression are like, that's bad, I need to avoid it or not have it or get rid of it or whatever. But
I'm not allowed to be that.
Be anxious. Be about anxious in these situations, or whatever situation feels right for you.
Use it.
Definitely. Use it. It's interesting.
I'm just thinking now, how many people have come to you and self-diagnosed themselves with something? Because I'm a really anxious person, but then if I start Googling stuff, I've probably got leprosy as well, or something stupid like that, isn't it? Google's the worst thing ever. So how many people come?
Google.
Dr. Google is not good, is he?
No.
But how many people come to you and go, I'm depressed, I'm anxious?
Quite a lot, because it is that process, isn't it? It's that decision, sort of like diagnosing themselves, I've got anxiety or I've got depression, is almost like that first step of going, all right, I need to see someone, then I need to go and see a counsellor, or I need to go and see a doctor. So most of them will know before they come, or I'm experiencing some kind of anxiety or got some kind of depression. They may not realise to what level or what it is that's causing it or what it is that's triggering it. That's obviously the process of counselling that would help them understand that. That's my job, isn't it?
Do you think you tend to get people that have at the further, like the more extreme amount of depression or anxiety or whatever the condition is, just because people put up with things for a certain amount of time, and like you said,
I've gone too far now. I need help.
At what point do people typically sort of come over to you versus just self-managing or whatever?
Just like I said, at the point where it starts affecting their life.
I suppose,
on a day, just working with someone at the moment who's just like for years and years and years, he's just been for as long as he can remember, he's like going back to childhood, he just remembers being just really anxious.
Right.
And but again, it came from childhood. It was almost like we thought at the beginning it was like a bit of learnt behaviour, because the parents had sort of like suffered from a lot of sort of like mental health and anxiety as well. So he thought growing up that was the norm.
Yeah.
You know, so he didn't realise that there's another. It doesn't have to be like that, because he spent 30 odd years of being like that, and it's like, oh, okay, so maybe I don't have to be like that. And sort of like confidence, self-esteem and things like that, you know. In particular, this particular person was sort of like suffering from imposter syndrome, and I just used the word imposter syndrome. It's like, what's that? You know, and described what it was. That's a thing. That is exactly how I. Yeah. So that's a thing. That real? That's real. That's a thing. I said, yeah, that's an absolute thing. You know, this is a real thing, and just the relief of, well, okay, well, it's the thing. Then I know that it can be sort of like I can help myself now. There's ways that we can sort of like manage it, and just hearing the relief in his voice by being validating it. That's okay. It is a thing. The things that we can do to help you with that, put coping strategies in place. Just made such a difference. But for years, it's like, this is the normal for me, but it doesn't have to be the norm.
Yeah, definitely.
I guess it's quite nice for people like that as well to realise they're not the only person suffering with that. As soon as you say imposter syndrome, like, wow, that's a thing.
Someone else has got this. Like,
exactly. I'm not alone here.
Yeah, well.
So I'm guessing once you get diagnosed with something like that, you're on the road to recovery type of thing.
Yeah, and I think that's where group therapy would come in useful for people, for some people as well. It can take a lot to go to group therapy. But I think in group therapy, sitting around hearing other people's stories and going, oh yeah, do you know what? That's the same, you know? It's sort of like, I don't like the word normal, but it does normalise and validate people's feelings. They go, oh, do you know what? Yeah, and then you can share ideas on how to manage it. And it just, that again, is just so empowering for a client as well.
I bet it is, yeah. You spoke earlier about parents and passing things on down the family. Is having mental health issues or conditions, do you think is passed on down through families or not?
It's got to be, isn't it? I don't know.
There's an element. Are you saying?
No, go ahead.
Do you recognise it?
Yeah,
what do you think?
I just think like you learn so much. Like kids are just learning machines, aren't they? They just suck in information. Yeah. So like between the age of, I don't know, 0 and, for the most part, 16, 17, 18 years old, people just suck in so much information from their family, their friends, you know, the people they associate with. So you're going to have so many learned behaviours, and like,
that's the word.
Like,
learned behaviours.
That you're not gonna like. I don't want to do this because I've never seen somebody do this, or I don't know how to do this, or nobody's ever taught me. So I think like it's a nature nurture kind of thing, isn't it? It's like
absolutely. I mean. Yeah, there is definitely an element of learned behaviours in some mental health. Not all of it, some of it, you know, there is that talk about chemical imbalance and things like that. And we've got to be careful as well that we don't sit there and say that the reason there's loads of mental health and anxiety out there is because of the generations and generations of parents. And then we're going to have loads of parents coming to us worrying about guilt and, I'm here to blame and I need to work on my guilt that I'm feeling. So we don't want to certainly don't want to put the blame on lots of generations of parents out there. But there's an element of learnt behaviours, but it's not all down to that.
Again, I want to speak about you now and counsellors. What kind of skills do you need to be a counsellor? Because what I'm getting from you is you're so calm and so softly spoken, and even when I'm speaking, I'm thinking, she's listening here. She's taking everything in. But if I speak to Josh, I'm like, he's glazed over, he's bored already.
He's thinking about what he's having for dinner. Active listening, being able to actively listen is a really, really a very valuable skill to have as a counsellor. And active listening is not like what you said, you know, you can see that I'm hearing what you're saying, I'm really taking in what you're saying. Just having a general conversation around a table in a room where you're all having cups of tea, you're not really listening, you're thinking about what you're cooking for dinner tonight, you know, getting the kids ready for school, you know, what you've got going on that week. That's not active listening, that's not being present. Presence, being with your client, just being present and really feeling and hearing. So empathy, really good active listening skills. Non-judgmental, that's one that you know, and in fact, this is a big part of the counselling training. I always see a change in my students when we do the lesson on difference and diversity, because that's all about recognising, you do have your own values and beliefs. We all have different values and beliefs, but it's about leaving them at the door when you're in a counselling. If you've got a client in front of you that says something that goes against your own sort of like core values and beliefs, it's all about emphatising, okay, this is about that client you're seeing the world.
It's not about you.
From the perspective, it's not about you.
Get you.
So that's a big part of being able to be non-judgmental, leaving your own values and beliefs at the door and not imposing them on your client as well. But
I've just written that down. Is that hard not to be judgmental? Because you're thinking, well, I don't agree with that.
Yeah. I think that not being able to give your opinion on something I'd struggle with, because I feel like whatever sits in my head makes sense for me to say it, and it might work for them or it might not. But I guess being like impartial is big.
We all view the world very differently. So what sadness looks like for you would look very different for you. And we want to try and understand what it looks like from a client's perspective, not what it looks like for me.
Yeah.
So, you know, Gary, you and me, we could have been, we could have been, you know, imagine sort of like we could have experienced the same thing.
Yeah.
But how we feel and how we experience it emotionally is very different.
That's interesting.
That makes sense.
You know? So
really
it's not about, you can't. One of the things that I read, the big bugbear of mine, is when people turn around and go, oh yeah, do you know what? I know how you feel because that happened to me.
You don't.
No, you don't. You really don't, because we all experience life very differently.
Yeah.
You know, it's all about seeing it from your client's perspective. So maybe years ago, I probably would have struggled, but through my training and experience as a counsellor, you know, you might see someone walking down the street and they might be sort of like, I remember the first time I really felt this, I was on a bus going into Cardiff, and I saw some guy was kicking off on the side of the road, and the police were there, and you could see people on the bus looking, and they was like, oh, what's going on? Look at him causing trouble, and proper judging. Yeah. And I just sat there and thought, what's going on with him? What's happening? You know, is there something going on at home?
That's a completely different outlook there, isn't it?
Yeah.
You know, and that was just, in that moment, I was like,
that makes sense.
There's a reason why people behave the way they do. I don't know if you ever heard of the iceberg analogy. No. But the iceberg analogy is where, you know, the bigger part of the iceberg is always under the water, isn't it?
Yeah.
It's a little bit that you can see above the top, and the bit above the top is like the conscious mind. Yeah. So you could say, or conscious feelings, and what we see of how someone behaves. That could be someone anger, like this guy that's on the side of the road. But the biggest part of the iceberg is under the water, the unconscious. You know, the pain, the conflict. You know, just anything that they're going through, you know, rejection, abandonment. That's the bigger parts that are going on that we don't see.
Yeah, definitely.
You know, and counselling gets to, you know, especially psychodynamic counselling, where you've got time to work with it. You start digging down and trying to dig into the unconscious and bring that up to the conscious.
So you'd look at that person and go, there's a reason why he's acting like that. Yeah. When I'd look at him and go,
that guy's
he's being a dick.
Yeah.
Completely
but most people would. That's just, we are in. You know, it's difficult to not be judgmental. We are only human, and we can. And that first second, you might sit there and go, "Oh, what's going on?" And then you go, but maybe it's just years of experience. I was just able to just take a step back and go, "What's going on for that person?" There's something going on for them to behave in, or reacting in that way. But we are judgmental.
Yeah.
You know,
I am a bitch.
It's part of us being as humans, but it's just how, you know, I think it's absolutely fine to have judgments. It's just how you manage those judgments.
Yeah.
You know, it's about being able, in counselling, is about being able to put those judgments aside to be with the person that's in the room with you.
Yeah, makes
but again,
sense.
I'm guessing that's why you take time out afterwards to offload all that.
Yeah,
go and have a cup of tea, sit down, be yourself.
Yeah.
Stand in the rain, whatever you've got to do, because
clinical supervision.
It's incredible, to be fair to you.
Yeah, no, it's awesome. It's so good. Yeah.
I take everything home me.
Yeah, I know. I always said, like, I could never do like emergency services type stuff, or like social stuff, anything like that. I feel like I would think about it 24/7, and I'd be up at night or first thing in the morning, just stress me out. So
just gonna ring Di for a minute. I just thought of something, type of thing, innit? We constantly thinking about this. So but you are exactly the same as a doctor. Like I keep saying, doctor helps us physically, the counsellor helps us mentally. And people don't see that enough, really.
No, definitely not.
Where they'll go and see a doctor if they stub their toenail, but they won't go and see a counsellor when they need to, or if they want to level up.
And it's just as important to look after the brain, if not even more important.
Even more,
I would say
well,
so.
I'm walking around with a broken ankle.
You went to the doctors for that. You wouldn't have not considered going to the doctors for that, would you?
No.
You know?
Definitely not.
So.
But that's evident there. The bone sticking out the side of my ankle.
It's visual.
Exactly. I need to go and get that fixed.
That's the fine. Not being able to see it.
Yeah.
That's the thing, isn't it?
Yeah.
Definitely is,
because you can't see it.
Yeah.
We talk about this quite often, where a lot of people wear masks. So you're sat here now and wearing my mask, where I'm confident and I'm on top of the world and everything's fine. As soon as you take that mask off at home, behind closed doors, you're a completely different person.
Yeah, 100%.
And you can't do that with physical injuries.
No. Yeah,
you can't, because your ankle's broke, But if something's not quite right with you, putting that mask on makes everybody think it is.
We've learnt so much over the years of just trying to just get on with it, like we said earlier on, you know, just having to get up, because we have some people that have a choice. You've got to get up, you've got to go work, you've got to earn a living, you've got to pay your bills, you know, and they just, and that's why a lot of people feel trapped as well, because they think, well, I can't take time off work, I can't look after myself, I can't give myself time to heal, because I can't afford to go to work.
But I'm guessing that just makes things worse then. The longer you put it off, the more baggage you kind of carrying, the worse it gets, and then
that goes back to 60-year-old men or women or whatever. They've been through all of that. Maybe, you know, money is no longer an issue. Work is finishing or coming to a close, like you said, partners and things like that. Then it becomes a real problem. Then you have to deal with those things. So you're forced to.
I liken it to an analogy of an airing cupboard, where every time something happens in your life, you have to shove something in an airing cupboard, and at some point that airing cupboard is just going to get so messed up and so full that you can't even shut it anymore. And then one day you're going to open it and everything's just going to fall down on top of you. That's life, isn't it? That's what's going to happen if you just keep shoving it and shutting the door. At some point you're not going to be able to shut the door, and you're going to open it and everything's just going to fall down on top of you.
And I'm guessing you've had people who have walked through your door and opened up that airing cupboard and gone, blah. Watch this, Louise. I got a lot.
Just a brain dump.
Absolutely. And then by the end of it, their own cupboard's nice and tidy. They've thrown some bits out that they don't need anymore, and it's nice and tidy. It's all in order, and they can shut the door now, and they feel like they've managed to.
But I'm guessing it's just not a vicious cycle, but in 6 months' time, that airing cupboard is going to become full again. And they need to offload again. And it hasn't got to be
just management, isn't it?
It is about management. Therapy can also just be about managing that as well. So in the past, they may not have managed it so well that we can look at, you know, towards the end of therapy, we can start looking at, okay, what have you learnt from therapy? You know, number one, how would you recognise that you're going down this path again? And what can you put in place to stop yourself getting to the reactive stage, you know, that distress stage where you do have to access therapy again if you do. And it could just be, you know, I notice sort of like, maybe sort of like on a good day, on a good week, I might have 1 or 2 bad days, and then if I'm starting to have 3 or 4 bad days every week, so I know things are not going quite great again, so I need to pick up the phone to Lou and book another session, and they may not need as many sessions as they needed before. They might just need to talk.
Of course,
So we get them to think about, you know, what could you do differently next time so that you don't get back to that. To where you were originally, but life gets in the way. Life happens, like you said. You know, you start shoving things back in the airing cupboard again. But it is about how we manage it.
Do we need to, as a human race type of thing, just appreciate that bad things are going to happen? You are going to get bad days. But I'm guessing as long as you get more good days than bad days, is that the way we need to get?
Yeah, I'd say so. You know, sometimes as well, there's that fear when someone comes to therapy, they've had a bad day or a bad couple of days, and they worry that they're taking about 20 steps back and they're going back to where they were at the beginning of therapy. We go, no, it's okay to have a bad day. Even someone that may not be in that state of sort of like mental distress that doesn't need counselling will have a couple of bad days or maybe a bad week. You know, that's okay. That's life, isn't it?
Yes. We're all under pressure, don't we? Especially with work and home life. Things are going to go wrong for you.
I always think like in that I find it, if I put it on myself, so if I like make it everything's my fault and problem because I chose to do whatever it is I'm doing in my life, so I find I deal with that by like turning it back on me and being like, whatever has happened, whether it's good or bad, or the day or the week or whatever has been shit, then it's my fault, I chose to do that. I don't know if like that's how my brain works in like squaring it up.
But are you constantly blaming yourself for things then?
I don't think so. No, because I
turn into a counsellor.
Talking to each session. I have to pay Louise before she leaves. No, I don't know. I'm very like a high level kind of take things as they come kind of person. So a lot of me thinks it is what it is, and that's how it is, and I'll get on, and tomorrow's a new day. But yeah, thinking about like, oh, this happened to me today. If I wasn't in this place, in this location, then it wouldn't have happened. So it's my fault for kind of being there. Not like fault's kind of like, I don't know, a harsh way of putting it, I guess.
There is an element of taking responsibility in counselling. Sort of like taking responsibility. You know, people are taking responsibility for their own mental health by coming to counselling as well. They want to,
exactly.
You know, things can't change. What is it that Einstein said? You know, the definition of insanity is expecting something to change but not doing anything about it. I can't remember the exact saying.
Yeah.
But that's the same with, you know, things are not going to get better unless you start to put change in place.
Yeah,
you know?
of course.
But also, what you're saying is, saying it's also about recognising that things will happen out there that are beyond our control.
Yeah.
Okay, so you can take responsibility for things that were in your control.
Yeah.
If it's gone wrong that day, but if you can look at the bigger picture and go, well, I wasn't in control of that.
Yeah.
And I wasn't in control of that. That can take some of that heavy responsibility away from you.
Yeah. So we talk about, like we keep saying, control the controllables.
Yeah.
If you can't control it, then let it go.
Exactly.
Which is easier said than done, I'm guessing, though, isn't it?
Yeah, of course, yeah.
Yeah, it is
Brain's
easier said.
complex,
Practice takes perfect. Practice makes perfect.
Yeah, the amount of people have said to me, "Oh, just get over it."
Yeah.
Well, okay,
it's not like that.
I wish I could.
If only.
Yeah, you wouldn't need me at all.
Exactly. Let's talk about some coping strategies. I can't. Strategies. That's the one. Something like that. I don't want you to tell us everything now, so we don't send people your way. But let's use me for an example. I suffer with anxiety. Give me a couple of coping strategies to get over that.
Okay. So if you're thinking about it in the moment, okay, and again, wouldn't want to go into bits and pieces because we could talk about it. But it depends, you know, anxiety can be caused by a thought process that leads to that anxiety. Okay. So a lot of people will sit there and think, going to the shops makes me anxious. It's not going to the shops that makes you anxious. It's your thought process about going to the shops that makes you feel anxious. So your thought process of going to the shops could be, if I go to shops, everyone's going to look at me.
Yeah.
It's that thought.
It's not going to the shops.
It's not going to the shops.
It's the looking bit.
It's the thought about what's going to happen when you go to the shops that is going to lead to that feeling of anxiety. So you could challenge that thought process. Well, actually, if I go to the shops, you know, Joe Blogg's walking down the street past me, doesn't even care about what I'm wearing or what I'm doing, and they're just thinking about what they're going to have for dinner or what they've got to do at work the next day. Yeah. So you can challenge, you know, we could do a lot of challenging irrational thoughts. That's a good coping strategy for anxiety. But there are things that you can do to help in the moments you're feeling a bit anxious. There's some breathing techniques. A common one we use is a 4-7-8 breathing technique. I don't know if you've ever heard of that.
No.
So a lot of people think when they go anxious, they go, oh, just focus on your breathing. So they sit there and go, and it don't work like that. There is a technique. So 4-7-8 is breathing in for 4 seconds, holding it for 7 seconds, and then breathing out for 8 seconds. Okay, so it's controlled breathing. Okay, and that does work. That really works at bringing your heart rate
It's almost like a meditative kind of practice, isn't it?
Yeah, well, meditation, mindfulness, anything like that is good coping strategies. There's lots of different apps out there, like Calm. Some of them are free as well. Some of them you'd have to pay to
a monthly subscription
subscription and things
to
like
get
that.
the best bits.
But distraction is key. If you're feeling quite anxious in the moment, sort of like trying to think about your favourite place and closing your eyes and imagine yourself in your favourite place. And then another one which is we use is called the 5 senses. So you look around in the moment, you look about 5 things that you can see. So I can see the clock, I can see the light, I can see the microphone, I can see the phone, I can see the keys. And then you look at 4 things you can feel. So I can feel the desk, I can feel my trousers, feel my hair, feel my glasses.
Thanks for that.
3 things you can hear. It's quite quiet in here at the moment, but you might be able to hear the birds or a car driving by or a phone going off or something like that. 2 things you can smell, maybe my perfume or
Josh.
And then 1 thing you can taste is like coffee or chewing gum or something like that. But the idea of the senses technique, that's a grounding technique. So we think about, if we're thinking about what we can see and hear and smell and taste in the moment, it brings us back to the moment. It makes us more present. So that's the purpose behind the
because you're thinking elsewhere type of thing.
Anxiety is always based on something that could happen or something that hasn't happened. It's normally based on the future. if you think about something that you're anxious about, I couldn't go to the shops because I'm worried that someone's going to look at me. That's something that hasn't happened.
Yeah.
You're worried about something that hasn't happened.
Yeah.
Or you could be, you're not normally anxious about something that's already happened.
No.
You're anxious about something that could happen,
of course,
or something that won't happen.
Yeah.
So it's about bringing you back to the moment. It's about being mindful and bringing you back to the present. So you're not worrying about what's going on in the future. You're just thinking about what's going on now.
I read a book recently called The Power of Now. So interesting. It's such a good book.
And that
present.
It literally it just focuses on the now so much, and and taking about like you just said, like anxiety is like a future thing, and then depression's like a past more
thing.
often not.
Absolutely.
So yeah, super interesting.
Yeah, we tend to be sort of like, depression tends to come from something that's happened already.
Yeah.
And anxiety tends to come from something that hasn't quite happened yet.
Sometimes because of something that had happened in the past. So you're anxious of something that's happened in the past. Is that a thing?
And you could be worried about it happening again.
Yeah. So like repetition of that, I guess.
I saw something. It's not a quote or anything, but somebody said, if you worry about something that hasn't happened, when it happens, you've lived it twice.
Yeah, that's true. Yeah,
that's interesting.
I like that as well.
So I forgot now.
You've got to remember it now.
No. If you worry about something that hasn't happened, when it does happen, it's happened twice.
Yeah,
you've almost lived it twice.
You lived it twice.
Sense. Yeah.
So
class.
Yeah, it doesn't help me at all, that saying, but it's an interesting saying.
Yeah,
it gives you something to think about, though, doesn't it?
Yeah, it does. Definitely.
Hang on a second, I don't want to go through this twice.
Yeah. And
let's park that. I'm not in control of that right now, apart from to park it.
Yeah. And like you said, it might not even happen either.
Yeah.
So you get anxious about things that may not happen.
Yeah.
That's what I do anyway. I get anxious about things, and 9 times out of 10, that thing doesn't even happen.
Yeah.
So I'm thinking, what a waste of time that was.
Yeah.
That's what they say about a rocking chair, isn't it?
Yeah.
Well, it gives you something to do, but it doesn't get you anywhere.
No, that's true. Yeah. That's me.
True.
Yeah. That's me, like this.
Yeah.
It is, definitely.
You don't gain anything out of that, though, do you?
No. And I don't even learn how to deal with it when it does happen.
Yeah.
I just wind myself up even more when it does happen. I think,
yeah.
I still don't know how to deal with it. But yeah, that's perhaps that's where I need to be starting to reach out to people like you and go, there's definitely help out there.
Yeah. Like Louise said, if you repeat, like, understand what it is and get to a point where you can manage it, and then repeat that, and then it becomes like a learned behaviour, and then that thing doesn't make you anxious. It doesn't. I don't know.
Yeah, that's where CBT comes in very useful for anxiety, because it is about changing potentially learnt and conditioned behaviours. Because they say that something has to happen 28 times for it to become a conditioned behaviour. So if you were to stand someone in the corner of the room and say, you're rubbish, you're rubbish, you're rubbish, you're rubbish, 28 times, sort of like over the space of a month, by the end of it, they will be conditioned to believe that they are rubbish.
Yeah.
If you turn around and say to someone, like, you're worth it, and you get them to say, or you get them, it's all about positive reinforcement themselves, where I'm worth it, I can do this. And you get them to say it to themselves, and they do it sort of like every day for a month or something like that, they will begin to recondition themselves to believe that they are worth it, and that they can do it, and then they start to see a difference, and the brain looks for that evidence as well, and they can start to see that difference as well.
In my mind, if somebody keeps telling me you're rubbish, I will believe it. But then I didn't really think of the other side of the dice, or the other side of the coin type of thing. If somebody tells me I'm good, and they keep telling me I'm good, eventually I will end up believing that. But I never thought of that, really.
No, not at all. No.
So yeah, that's an interesting one.
It has to be, that's how CBT works. You kind of sort of like have to almost like recondition to a new behaviour.
Yeah.
I guess consistency's big then. Like getting, 100%. You have to be consistent there.
Routine, consistency. But that's good for any kind of good mental health anyway. Routine, we know about sort of like exercise, a good diet, good routine. Helping others is good for good mental health as well. Having a good hobby. Having that feeling of sort of like, you know, like you've achieved something.
Yeah, of course,
You know, if I have a day where I don't do anything, I get quite anxious if I don't do anything. I suffer from anxiety. My anxiety is based around if I'm not busy. So if I've not got any work booked in, or I haven't got anything planned, by the end of the day, I'm really anxious because I feel like I haven't done anything. Yeah,
I get that. I just come to me then, like as you said it, like I'm almost pissed off at myself if I haven't done something productive. I sat on the sofa all day, like I did today a little bit, and then about an hour before we came down here, I was like, I gotta do something today, otherwise it's gonna be dark and I'm gonna be frustrated for not doing something at the house.
You did your swim this morning.
I did a swim.
Still struggling on that. But surely we need that time as well Do we need a time just to sit down and go, I'm not doing anything today?
We do, yeah, we do. And that's something that I'm teaching myself already. You said to me, when do you have time for your family? I am trying to teach myself that it is okay to have that time out. But I'm not perfect. I struggle too.
Of course. But it's nice to see that even though you're a counsellor, it's not nice, that's probably the wrong way of saying it, but everybody has their own problems.
Human, everybody,
Yeah, like when you're human.
Yeah, exactly.
I can still suffer from anxiety as well. I'm not immune to anxiety.
No, of course not. No, just because you're there to help other people doesn't mean you can't suffer yourself, type of thing. Let's talk about your business. So, like I said, it sounds like I could talk to you for hours.
Yeah, I know.
You're a counsellor full time now. Yeah, you teach as well. So
I do part-time counselling.
Part-time counselling.
Only because, like what we said earlier on about you couldn't do full-time counselling.
No,
I'm a member of the BACP, which is a regulatory body anyway, and if you're working safely and ethically, you wouldn't do full-time counselling.
Wouldn't you?
If you look for counselling jobs, the majority of them are part-time.
Yeah.
Because it's not, you wouldn't want to
that
work.
Makes sense.
Never thought of that.
Can you imagine working
sense,
37 and a half hours a week as a counsellor?
No.
Yeah, God, yeah.
No.
Yeah, so
I
I do
don't know how you
part-time
do-
counselling
I don't know how
and
you
I
do
do part-time teaching.
Yeah.
But it's teaching, counselling as well, isn't it?
Yeah.
Yeah, I teach counselling as well, So, I teach I've taught level 2 before as well to help out, but my baby really is level 3 counselling, and I teach year 2 of level 4 counselling as well. So that's when people are coming to the end of their counselling training. They're doing their sort of like placement hours, and so it's really nice because I get to see them from level 3 all the way through to the end when they qualify. That's a lovely part of my job. I love that.
Amazing.
Yeah. I can imagine it. Well, every part of your job is really rewarding, really. Especially, and then, do you ever sign somebody off to say, off you go?
Yeah.
How rewarding is that then to say?
So I have to sign off their I can't think of the one I'm looking for, brain fog, but I have to sign off their sort of like capabilities.
Yeah.
Their abilities. What's the word I'm looking for? Mine's gone completely blank. But I have to sign off, their ability to be a counsellor, and then we send it to the awarding body, and then that gets EV'd, and then the awarding body are the ones that say okay. But I'm the one who, because I see them in the classroom.
Yeah.
I know what their skills are. We do skills practice in the classroom. But we don't just take on skills practice. I'm listening all the time to my students.
Yeah, we can see that.
They're part of their sort of like, even their, involvement in class discussions and things like that, and things they're saying, and, reading and marking their work and stuff like that. So I'm the one who signs off their sort of like,
I can imagine being really...
council. I'm going to send it to the awarding body now.
Yeah, or you're not.
And their supervisor. They have to have clinical supervision, obviously, as a student, same as me as a qualified counsellor.
Yeah.
They have to have supervision, and their supervisor will sign off. They have to have reports from a supervisor as well to say that they're okay to work.
What is
clinically safe to work as a counsellor?
Oh, right. I was going to say, what is the clinical supervision? What's that? So that's just like...
and it's the same as what I have. It's just somewhere where, again, to work safely and ethically, it's somewhere where I go.
Yeah.
In fact, I've got it tomorrow, actually. Yeah. Where I go on a monthly basis to have a conversation with another counsellor, but a supervisor. So he's got a qualification of a supervision. And, we just sort of like have a chat about any client work, any clients that might be particularly stuck.
Yeah.
We don't just talk about struggles in counselling. It's also a good place to go and sort of like rave about your achievements as well.
It's really important,
acknowledging your good work. It's just as important to go, right, I'm struggling with this client, but actually this client was great. Look at the work that we've done. Look at where they're at now.
Yeah,
amazing.
And just identify any areas for additional like CPD, so continued professional development.
Yeah.
And just talk about our own thoughts and feelings, how that could be impacted. Is there anything about our own thoughts and feelings that could be impacting a process or a client, anything like that, really?
It's nice to see it's regulated as well.
Yeah, definitely,
Not legally.
No, it's nice,
Not legally. If you're going to... So, if anyone is going to be looking for counselling, what I will say is the best place to go if you're going to look for a counsellor is somewhere like the BACP or the Counselling Directory, because they are regulated.
Or
the National Counselling Society, because they are counsellors that have done appropriate training. Because there are counsellors out there, because it's not legally regulated like doctors and nurses.
Wow.
Anyone could call themselves a counsellor.
No way.
Anyone could call themselves a counsellor, and there are courses out there where people would do like a 10-week online course and then say, I'm a counsellor.
I guess it's really like when you first said it, I was like, why is it not regulated? That blows my brain. But then as you like explain why, it sort of makes sense because it's so grey. Like I could go and have a coffee with Di or Shorty or whatever, and we're sitting and talking, and whether you charge for it or not, like that's technically a form of counselling, I guess, one way or another. It's not like you said, regulate or whatever, but you're listening to somebody, taking on whatever, like what we're doing here within Tackle Your Thoughts. Come to us and talk if you've got issues. Like talk. We're not counsellors. We're definitely not regulator or anything.
But
like
somebody
that.
would call themselves a counsellor for doing that.
Yeah.
Well, they wouldn't be doing anything wrong if they did.
No.
Because it's not a legally regulated body.
Yeah.
They're working towards it being a legally regulated body. If you think about the work or, the damage you could cause
to
someone if you didn't have the appropriate training. But places like the BACP and the National Counselling Society are places that will only have, counsellors. You have to prove that you've done the appropriate, relevant qualification, which is classroom teaching, skills work in the classroom, and placement hours, 100 hours of placement with clients as a trainee counsellor. Then you can be a member of a regulating body like the BACP or the NCS. So if anyone is to look for counselling, make sure that the counsellor has got the appropriate, they would need to be going through really a minimum of 4 years of training. They need to have that diploma. They need to have had, or whatever their training they've had, it needs to have had some kind of placement hours in it. But, clients wouldn't think to ask it because they don't know that.
No, of course not. I didn't know that.
But the BACP and the NCS do know that, so they'll only have counsellors on their books that have been through the appropriate training.
BACP.
BACP.
Yeah, we need to show about that.
Yeah,
British Association of Counselling and Psychotherapists.
Yeah,
and the NCS, which is the National Counselling Society.
We'll link that in the bottom of the video and all the podcasts. So
you're getting a suitably trained, ethical, safe counsellor that goes to clinical supervision, that's had the appropriate training, and has the appropriate skills and practice to be able to practice as a counsellor.
Yeah, because that's really important. Like you were saying earlier about being non-judgmental and all those things. It's so easy to listen to somebody and be judgmental or have opinions and whatever else.
Can you imagine the damage you could do?
Exactly. Yeah, you could send somebody in the wrong direction.
Definitely. Yeah.
Absolutely.
Perfect. So it's a great bit of advice. Before we finish off, I want to just touch on, do you have any advice for anybody out there who's struggling at the moment, be it depression, anxiety or anything like that?
I don't give advice, I'm a counsellor.
Ticking the box there, BACP and MCR, she did it right there.
Just ask for help.
Yeah.
Just like you said earlier on, it's not weak to ask for help. If anything, it shows a sign of strength.
Yeah,
love
because it's the hardest thing to ask for help.
Yeah.
The easiest thing is to not ask for help. The hardest thing is to ask for help. So speak to people around you. Communication is so key. Speak to others, access counselling, go to your GP. There are people out there that can help. So ask for that help.
Yeah.
If I'm allowed to give advice, it would be to ask for that help.
Yeah. That's personally not as a counsellor. That's Louise. Is there anything else you want to add, Louise? For me, this has been really powerful.
Yeah, it's amazing.
I've learned a lot. It's unbelievable the way.
I want to talk all night.
Yeah. I don't think you take advantage of people like you.
I've got to get him and do some marketing, sorry.
So you got to go. But I generally don't think we take advantage of counsellors enough, to be honest. Like I said, and you said, we all think it's weak to speak to somebody else you don't, especially because you don't know that person.
Of course, yeah.
But again, it makes it easier then because they're non-judgmental and just going to sit there and just talk.
Yeah.
That's what a lot of people say. It's easier because they don't know the person.
Yeah, exactly. Yeah.
You don't know my family. You don't know who I'm talking about. No. I can just say what I say, and it doesn't impact you. Whilst if you were to go home and speak to your partners, that impacts them because you live with them, doesn't it?
Of course it does. Yeah.
So a lot of people don't like to talk to family and friends because they're worried about the impact it has on them, or they're worried about. And also, a lot of people say, "I'm worried that they're just going to sit there and give me advice," and I don't want advice. I just want someone to hear what I'm saying.
Listen to me.
So no, I just want to say thank you because obviously I'm really passionate about counselling because I do it, and I teach it. That's how passionate I am about it. And I feel honoured that I can teach the next generation of counsellors that keep coming through. But
it's incredible.
I just want to say thank you because people don't know. A lot of people still don't know the power of counselling out there until they've accessed it.
Yeah, and I didn't.
No.
Even though I've been through counselling myself, to hear a counsellor speak about it that way is incredible. It's a
fly on the wall kind of view of it.
It is.
Yeah, it's really interesting.
From us, keep doing what you're doing, Louise.
Thank you.
I don't think you realise how many lives you're saving.
Yeah.
Because I think, I keep saying, doctors get praised because they fix somebody's legs.
It's visual, isn't it? You can see it, but you're doing what doctors do, but on a mental health side, which, like you said, is arguably more important than a broken arm or a broken leg. So,
But
awesome.
You're doing yourself proud. You're doing your family proud, Louise. Thanks for coming on today.
Thanks for having me.
Been absolutely amazing. Your business, are they on social media?
Yeah, L&J Therapy.
L&J Therapy.
Facebook and Instagram.
Brilliant. We'll put them down the
I've got a
bottom.
website as well.
Yeah.
Cool.
Which is
www.lnjtherapy.com.
LNAtherapy.com.
Yeah, we'll put it down at the bottom.
Yeah.
Any of our listeners, if you want to get in touch with Louise, her contact details will be underneath.
Yeah.
Myself and Julie, we both run L&J Therapy.
It's two of you, is it?
Two of us.
Perfect.
Amazing.
So
Louise and Julie.
Yeah.
L&J, that makes sense.
Yeah, no, if anybody is listening and thinks, that might be worthwhile, then lean into us and we'll push them towards you, or lean into you guys directly. It's amazing what you're doing, and I can't condone
Thank you very
people
much.
should do it.
Yeah.
Thank you.
Thanks Louise.
for
Thank you
having
very
me.
much.
Thanks.
Thank you.